How long are immunoglobulin M antibodies against hepatitis A virus, IgM anti-HAV, detectable in the blood after exposure to HAV? A. 7 days. B. 3 weeks. C. 1 to 10 weeks. Which of the following indicators is most likely to take the most time for surveillance data collection? A. CAUTI. B. CDI. C. VRSA. D. CLABSI. The ideal time to obtain a sample of sputum for testing acid-fast bacillus is A. Afternoon. B. Bedtime. C. Early morning. D. Midday. Which kind of vascular access device, VAD, carries the lowest risk of infection for individuals who need hemodialysis? A. Arteriovenous fistula. B. Arteriovenous graft. C. Right internal jugular catheter. D. Subclavian catheter. The most likely cause of mastitis in nursing mothers is A. Maternal flora invading nipple. B. Infant colonized with Staphylococcus aureus. C. Contaminated breast pump. D. Inadequate cleansing of breast. The term that denotes the typical occurrence of a particular disease within a particular geographic area over a particular time period is A. Epizootic. B. Endemic. C. Epidemic. Which of the following is an example of passive case finding in a suspected outbreak? A. Notify healthcare providers to be alert for additional cases. B. Examine county surveillance data. C. Ask the laboratory to identify further cases. D. Use a diagnostic test to screen at-risk individuals. What is the primary goal of infection control? A. Treatment of infections. B. Prevention of infections. C. Diagnosing infections. D. Managing infections. What is the term for the process of destroying all forms of microbial life, including spores? A. Sterilization. B. Disinfection. C. Antisepsis. D. Sanitization. Which of the following is a common mode of transmission for healthcare-associated infections, HAIs? A. Vector-borne transmission. B. Waterborne transmission. C. Airborne transmission. D. Foodborne transmission. What is the recommended duration for surgical hand scrubbing using an antimicrobial soap? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Which organization provides guidelines for standard precautions in healthcare settings? A. World Health Organization, WHO. B. Centers for Disease Control and Prevention, CDC. C. American Medical Association, AMA. D. International Red Cross. What is the primary purpose of a risk assessment in infection control? A. Identifying potential hazards. B. Treating infected patients. C. Establishing communication protocols. D. Evaluating employee performance. Which type of isolation precaution is recommended for patients with known or suspected airborne infections? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Protective precautions. What is the most effective way to break the chain of infection? A. Isolation of infected individuals. B. Hand hygiene. C. Immunization. D. Antibiotic treatment. Which of the following is a common vector for the transmission of infections in healthcare settings? A. Mosquitoes. B. Rats. C. Healthcare workers. D. Airborne particles. What is the recommended technique for cleaning and disinfecting surfaces in a patient's room? A. Wiping from top to bottom. B. Circular motions. C. Random patterns. D. Side-to-side motions. Which of the following is an example of a healthcare-associated infection, HAI? A. Influenza. B. Tuberculosis. C. Methicillin-resistant Staphylococcus aureus, MRSA. D. Common cold. What is the purpose of surveillance in infection control? A. Treating infected patients. B. Monitoring the spread of infections. C. Cleaning and disinfecting surfaces. D. Training healthcare workers. What is the primary purpose of personal protective equipment, PPE, in infection control? A. Preventing the spread of infections to patients. B. Protecting healthcare workers from infections. C. Enhancing patient comfort. D. Improving communication between healthcare workers. Which of the following is an example of a fomite? A. Mosquito. B. Doorknob. C. Healthcare worker. D. Airborne particle. What is the role of the infection preventionist in a healthcare facility? A. Administering medications to infected patients. B. Conducting laboratory tests. C. Developing and implementing infection control programs. D. Providing direct patient care. Which of the following is a common symptom of a bloodstream infection? A. Cough. B. Rash. C. Fever. D. Headache. What is the recommended duration for alcohol-based hand rub application for effective hand hygiene? A. 10 seconds. B. 20 seconds. C. 30 seconds. D. 40 seconds. Which infection control measure is most effective in preventing the transmission of respiratory viruses? A. Hand hygiene. B. Masking. C. Isolation precautions. D. Surface cleaning. In which situation is the use of sterile gloves recommended? A. Routine patient care. B. Blood pressure measurement. C. Wound dressing changes. D. Taking oral temperature. What is the primary purpose of environmental cleaning and infection control? A. Providing a pleasant atmosphere for patients. B. Reducing healthcare costs. C. Eliminating infectious agents from surfaces. D. Improving employee morale. Which of the following is a common vaccine-preventable disease in healthcare settings? A. Influenza. B. Tuberculosis. C. Norovirus. What is the purpose of antibiotic stewardship in infection control? A. Enhancing patient comfort. B. Administering antibiotics to all patients. C. Reducing the development of antibiotic resistance. D. Treating viral infections. Which of the following is an example of a standard precaution in infection control? A. Wearing gloves when touching blood, body fluids, and contaminated items. B. Isolating all patients with infections. C. Using antibiotics prophylactically for all surgical procedures. What is the primary purpose of a vaccine in preventing infections? A. Treating infections. B. Providing temporary immunity. C. Enhancing antibiotic effectiveness. D. Stimulating the immune system to produce immunity. Which of the following is a common healthcare-associated infection prevention strategy? A. Routine use of antibiotics in all patients. B. Increasing patient-to-nurse ratios. C. Implementing antimicrobial stewardship programs. D. Ignoring hand hygiene practices. What is the role of surveillance in preventing healthcare-associated infections? A. Administering treatment to infected patients. B. Monitoring and identifying trends in infection rates. C. Training healthcare workers in hand hygiene. D. Isolating all patients with infections. Which of the following is a common source of Legionella bacteria in healthcare settings? A. Contaminated water systems. B. Airborne particles. C. Human body. D. Food. What is the primary purpose of a respiratory hygiene cough etiquette program in healthcare settings? A. Reducing the spread of respiratory infections. B. Enhancing patient comfort. C. Increasing employee morale. D. Training healthcare workers in hand hygiene. Which of the following is an example of a healthcare-associated infection prevention measure for immunocompromised patients? A. Routine use of antibiotics. B. Isolation precautions for all patients. C. Use of high-efficiency particulate air, HEPA, filters. What is the recommended method for transporting sterile items in a healthcare facility? A. Placing them in regular bins. B. Covering them with a cloth. C. Using sterile containers or packaging. D. Carrying them with bare hands. Which of the following is a common symptom of a urinary tract infection, UTI? A. Rash. B. Fever. C. Cough. D. Painful urination. What is the primary purpose of hand hygiene in preventing infections? A. Reducing employee workload. B. Enhancing patient comfort. C. Eliminating infectious agents from hands. D. Improving employee morale. Which of the following is a common mode of transmission for hepatitis B virus in healthcare settings? A. Airborne transmission. B. Contact transmission. C. Bloodborne transmission. D. Waterborne transmission. What is the role of personal protective equipment, PPE, in the context of standard precautions? A. Wearing PPE is optional. B. PPE is not necessary for routine patient care. C. Using PPE based on risk assessment. D. Wearing PPE only during major outbreaks. Which of the following is a common sign of a surgical site infection, SSI? A. Shortness of breath. B. Redness, swelling, and warmth at the surgical site. C. Nausea and vomiting. D. Headache. What is the primary purpose of the Centers for Disease Control and Prevention, CDC, guidelines in infection control? A. Enhancing patient comfort. B. Setting standards for infection prevention and control. C. Monitoring employee performance. D. Treating infected patients. Which of the following is a common method for preventing surgical site infections, SSIs? A. Avoiding hand hygiene practices. B. Using antibiotics prophylactically in all cases. C. Wearing sterile gloves during surgery. D. Ignoring the aseptic technique. What is the recommended method for disposing of contaminated linens in healthcare settings? A. Mixing them with regular laundry. B. Placing them in plastic bags without labeling. C. Using color-coded bags and labeling as contaminated. D. Leaving them in the patient's room. Which of the following is a common measure for preventing central line-associated bloodstream infections, CLABSIs? A. Avoiding hand hygiene practices. B. Routine use of antibiotics in all patients. C. Inserting central lines in non-sterile conditions. What is the primary purpose of the chain of infection concept in infection control? A. Identifying potential hazards in the healthcare environment. B. Breaking the cycle of infection transmission. C. Administering treatment to infected patients. D. Enhancing patient education. Which of the following is a common mode of transmission for healthcare-associated infections in the neonatal intensive care unit, NICU? A. Airborne transmission. B. Vector-borne transmission. C. Contact transmission. What is the recommended frequency for cleaning and disinfecting high-touch surfaces in patient care areas? A. Once a day. B. Once a week. C. Twice a day. D. Once a month.